Welcome, dear friends. Today we are going to learn about prescription and specifically about handling and errors of prescription. Now, whenever the pharmacist he receives the prescription, what steps he has to follow that are included in handling of prescription. So, while handling the prescription, following steps should be followed by the pharmacist. The first is receiving, second is reading and checking, next is collecting and weighing the material, next is compounding, labeling, and packaging. So these are the steps. Now let us see each in detail. The first step is receiving. The pharmacist he should himself receive the prescription. He should not change his facial expression after receiving the prescription because this may give the patient the feeling that the pharmacist is amazed or confused after seeing the prescription. This might cause loss of faith in doctor of the patient. Next step is reading and checking. Reading the prescription involves um, completely and careful reading from top to bottom. Checking of prescription includes prescription should be checked for any incompatibility. It should be checked if the prescription is written on doctor's pad or OPD slip of hospital and signed by the prescriber along with the date. It should be always screened behind the screen. In case of any difficulty, consult other pharmacist or the physician, but the patient should not know about it. Means whenever the pharmacist is going to take the prescription, he has to go behind the counter and then he has to read it from top to bottom. During this time, he has to check if it is written on doctor's pad or OPD slip. Also, he has to check if the dose given is appropriate according to the age, weight, and sex of the patient. Okay, and if he finds any difficulty, if he is unable to read anything, or if he doesn't find why the dose is why this particular dose is prescribed, then either he has to consult colleague pharmacist or he has to directly call the physician. But in no case the patient should know about what all things are going on behind the counter. Okay, so these are the things. The pharmacist he should never guess the meaning of any illegal or confused word. He has to directly consult the physician. Why he should not do this? Because it might lead to very serious problems. Sometimes the prescription is received on telephone, so it should be checked after taking it down by repeating it on the phone to the prescriber. Drugs with same names mostly include acidin, apidin, prednisone, prednisolone, digoxin, digitoxin, eltrazone, elthrocin, etroxin. So the pharmacist he has to be very careful when he is dealing with such type of medicines on the telephone. So what he has to do when he comes across any uh, um, phonetically similar drugs name, then what he has to do, he has to uh, check the spelling of the medicine from the prescriber. Now let us see what are the errors in prescription. The sources of errors mostly include: the first is abbreviation. It presents problem in understanding parts of prescription order. So extreme care should be taken in interpreting the prescription. The pharmacist should not guess the meaning of an ambiguous abbreviation. Example, if acro is mentioned, one should not dispense acromycin because acrostatin might be prescribed. SSKI is a shorthand for saturated solution and chemical symbol for potassium iodide. Next comes the name of the drugs. There are some drugs whose names look or sound like those of other drugs. Example includes indocin, lincosin, prednisolone, digoxin, digitoxin, doridone, doxydan. Sometimes name of any pharmaceutical product is changed due to possible confusion with the name of other product. Such thing has happened with potassium supplement, and its name was changed from Kalium to Cholium due to possible confusion with former designation with Valium. The next error is strength of preparation. Strength should be prescribed. It is important when the drug is available in various strengths in the market. Example, it is wrong to dispense paracetamol 500 mg when prescription for paracetamol is not mentioned. Next error might be due to dosage form of the prescribed drug. Many medicines are available in various forms. Example, some drug is available in the form of tablets, capsules, liquids, suppositories, etc. The dosage form should be written in order to avoid error. Next error is dose. Unusually high or low doses should be discussed with the prescriber. Pediatric dosage may represent a problem, so pharmacist should consult the pediatric posology. Sometimes reasonable dose is administered too frequently, so you have to check sustained release dosage form prescription for every 4 hours, as these are to be dispensed only 2 to 3 times a day. Next error can be due to instruction to the patient. If the instructions are incomplete or omitted, it should be checked. All these things like quantity of dose, frequency, route of administration, etc., they should be thoroughly checked by the pharmacist. Next error can be due to incompatibilities. Check It is the responsibility of the pharmacist to check if there is no pharmaceutical or therapeutic incompatibility in prescribed prescription, and that the different medicines prescribed should not interact with each other to produce harmful effect. Certain antibiotics like tetracycline absorption is hampered by the presence of calcium ions. Hence, it should be checked that tetracycline is never prescribed with calcium containing drugs or with milk. So, this was all about handling and errors of prescription. Thank you for listening.